Hi, I'm Dr. Shimi Kang. Thank you so much for joining me today. Today we're going to talk about a really important issue, a sadly, tragically, very common experience of trauma. In this episode, I'm going to use the story, the very courageous story of Lady Gaga. Lady Gaga, whose real name is Stefani Germanotta, recently came out with a very brave opening up of her story of sexual assault and rape when she was 19 years old. This story was presented in a really important series called The Me You Cannot See, co-produced by Prince Harry and Oprah Winfrey. The series is about really opening up the conversation about mental health and how it affects people. And I'm going to use Lady Gaga's story with the utmost respect and reverence to explain the science of how trauma and particularly sexual assault might impact a body and mind, how we can understand this better, what we can do to help ourselves and others who may have experienced it, what are the solutions, and there are so many out there. Her story, I think, is a story that might be familiar to so many people. In fact, 1 out of 3 women and 1 out of 6 men and boys have experienced sexual trauma. Now, of course, gender is not binary, and we know that members of the LGBTQ community are even more at risk. It is so traumatic and difficult, these experiences, that 95% of people who experience them have symptoms of something called post-traumatic stress disorder. That's PTSD for 2 weeks after. Many, in fact, 13% actually attempt suicide, and many live with it for years on end, and often many don't disclose it at all. In fact, 1 out of 5 people who have experienced sexual assault, sexual trauma, blame themselves. There's a lot of guilt, shame, a lot of confusion surrounding these experiences, particularly when they may occur in childhood or adolescence. So today we're going to understand this experience. We're going to go deep into the science of it. Knowledge is power. I'm going to give you the knowledge. I'm going to give you the power to understand this situation, this experience that affects so many people, may have affected you, may have affected loved ones in your lives. And I'm so grateful that you took the time to learn how to really empower and optimize your most powerful asset, your mind, our mental wealth. Thank you so much for joining me. We're going to go deep now into the science of Lady Gaga's story. So let's understand what trauma does to the brain and body. I'm going to use my friend here, George. And so really, Lady Gaga said that when she was in that producer's room and she said, when I was told to take off my clothes, otherwise they were going to burn all my music. She said she froze. And that's really important because stress releases what's called the stress response in our mind and bodies. So stress comes and triggers an area of our brain very deep down called the amygdala. And the amygdala fires a response called freeze, fight, or flight. I have a whole video on this response. You can click on it here. Now, when we get that stress response triggered into freeze, fight, or flight, what happens in our mind is we get frozen or we freeze, and that's what Lady Gaga said. She said she froze. We can fight and fight back and get angry and hit or punch or scream, or we flight, we run away. But any of those responses are typical of the brain under trauma. So when that happened to her, she froze. She went into a state of freeze. What was happening in her mind and body is the release of something called adrenaline. Think of a deer in headlights or a rabbit that's just about to get attacked by a tiger or a predator. They freeze. And that's a mechanism, a very deep primal survival mechanism of freeze, and it's something reported by many victims. Many people, survivors of trauma, have described this shock, this frozenness, and that's exactly what happened to Lady Gaga. Lady Gaga also said she became completely psychotic when she found out she was pregnant. And people wonder, can trauma actually cause psychosis? It certainly can. So let's understand this a little bit more. She describes being dropped off at the corner of her parents' house, pregnant, after having experienced this sexual trauma and have been abused. Now, like I said, the brain goes into freeze, fight, or flight. We talked about how she said she felt frozen, and flight is any form of mental escape. So again, back to nature. Freeze is a deer in headlights, fight is a tiger roaring, and flight is a bird flying away or a rabbit running away. We run away mentally, we escape, and psychosis is part of that. Conspiracy theories or losing touch with reality. The ultimate flight, of course, is suicidal thoughts and paranoia and completely not being in this world in reality. So psychosis, or being, which is defined by, it's a mental health symptom that is defined by being out of touch with reality. Lady Gaga experienced it. It is an extreme form of flight. It can happen with trauma, and it can happen with chronic stress, something that she certainly experienced it. So yes, trauma can lead to psychosis. Some people ask, why did Lady Gaga self-harm? It's hard to understand when someone's been harmed. Why would they then inflict pain and harm on themselves, like cutting themselves or banging their head against a wall? Lady Gaga says that she had thoughts of all of those, and she actually did do those things. So let's talk a little bit about self-harm. So I've been a psychiatrist for over 20 years, and I've worked with many people who have self-harm or cut themselves or done things that hurt themselves. And it's a really difficult thing for people to understand. And I'm going to explain how it works from a scientific perspective. And when we understand why people might do it, it can certainly reduce the shame and judgment that people might feel. So when we're in trauma, we have that freeze, fight, or flight response that I mentioned, and people can often go into a state of feeling numb if they're frozen, and that can repeat itself later in life when the experience is remembered or relived, or there's something in the environment that might trigger it, or any emotional distress can restart that, triggering that trauma, that amygdala to fire. So young people or adults who self-harm, what's really happening there is they're trying to feel something. And when they cut themselves, what happens is our body is so wonderfully designed. Nature wants us to not feel pain. So when we cut or hurt our body, our skin gets ruptured, we get a release of endorphins immediately right away. And that's nature's way of saying, hey, here's a little bit of a painkiller. It's a little bit of endorphin because you hurt yourself. So people who have mental trauma, who've experienced mental pain in their minds from memories and experiences like Lady Gaga did, often go into a state of numbness or despair or freeze, fight, or flight. They can be out of control. Their minds could be racy, flighting, like I said, psychosis. They could be really angry, they could be anxious and mentally frozen. And then the act of cutting or hurting themselves or self-harm releases that little bit of endorphin, and they can suddenly feel a little bit of relief, a little bit of feeling again. And it's a really complicated thing. I don't recommend it, of course. Most people, many people who cut or self-harm, what comes after that then is this feeling of guilt, a feeling of shame. They don't want to talk about it, and it becomes a vicious cycle. So of course we want to understand self-harm. We want to not judge people. We want to give them the science of why they're doing it. It actually is based on science, and there's reasons that people do these things. So we want to understand it, not judge it, and then help people find other ways of coping. I have a video on coping coping skills, our 3 brains, and 3 powerful ways to cope with stress and trauma. You can click on it and find more information about that here. So now that we understand more about Lady Gaga's story and the story of sexual assault, which can occur to almost anyone, like I said, 1 in 3 girls, 1 in 6 boys, regardless of country, culture, or status, let's understand and empower ourselves with science-based solutions. Solution number 1 is prevention. So we want to start early the conversation and let young people know what is safe and how to reduce their risk. Some simple things like traveling to unknown places, not alone, definitely take a friend. Don't use substances, so always have a dry friend around you that can make sure that you're safe and that your judgment isn't impaired. Be careful in situations where there may be a power differential. In Lady Gaga's case, it was a producer. Many young people I work with, it can be a teacher, it can be a coach, it could be even a family member, an authority figure in their life. So you really want to be careful of power differentials, and then also honor your feelings and your intuition. If something doesn't make you feel comfortable, we want to guide young people to trust that and really take charge of their own self-worth and emotions, and don't feel bad about saying no. Feel empowered to say no if you're not feeling comfortable, if you don't want to do something. Trust yourself, love yourself, believe in yourself, and get out as fast as you can if possible. So all of those are ways to reduce the risk of this type of trauma happening. Now, if something does happen, then you want what's called early intervention. Early intervention means not waiting to get help and treatment, but really trying to get things healed and support as soon as possible. So tell a trusted person, a friend, an adult, a healthcare professional. If you have been assaulted or raped, you want to have evidence. You want to actually get a medical exam, and in most hospitals in North America and Europe, they have specific kits that will help the collection of evidence that can be given to the police. So you definitely want to get help, tell someone you trust. If you don't want to go through that process of collecting evidence, then take care at least of your psychological, your mental well-being, and start talking about what happened, how you're feeling about it. There's something called name it to tame it. And that means we really have to name our emotions. We have to say what we're feeling. If it's shame, if it's guilt, if it's helplessness, we have to express that. So we want to give it a voice, give it a name, and then work through those emotions, honor those feelings, let yourself experience them, and don't try to avoid them. That's really important, and process them towards empowerment. So what can I do different next time? What have I learned from this experience? How can I heal myself? What are my internal strengths that I can draw upon? And listen to stories of other people who survived and overcame and came out stronger and better. Those stories are so helpful to us, those role models of survivors, and there's so many out there. In fact, Oprah Winfrey herself experienced sexual assault and trauma in her childhood. And there's so many stories that we can draw from solutions to. You also want to consider professional therapy, perhaps. There's talk therapies, all kinds. There's journaling, there's narration therapies. Mindfulness is very helpful, and getting back to coping skills. Really understand that this experience may lead to that stress response, being fired, being too reactive. People experience, like I said, fight, irritability, flight, mental escape or distraction, or freeze, that feeling of anxiety and overwhelm. When those are identified, once you've named it to tame it, then you can bring in coping skills. I like to talk about 3 coping skills that correspond with our 3 brains. So don't forget, you can watch that video here. Sometimes people need more detailed and more intensive treatments. Sometimes people might need medications, whether it's for anxiety, depression, or substance use that might be part of it, or sleep medications, sometimes temporarily. Some people need intensive therapy, so actually admission to hospital or recovery centers. There's places that people can go actually and feel safe in a safe environment and process and get help through these experiences. Once you're in a state of recovery or healing, then you want to do what's called maintenance. You want to pay attention and prevent relapse of any anxiety, PTSD, or depression, or psychosis, or whatever it might be, because we always have to monitor ourselves and remember that other situations can trigger a relapse. Things can make us go back and go back to memories and traumatic experiences, or new life experiences, even sometimes positive ones. In my 25 years of being a psychiatrist, I've seen positive life experiences, including maybe getting married or being pregnant or getting your dream job or whatever, being triggers for trauma. And I think Lady Gaga talked about that, where she had to cancel one of her entire concert tours. The pressure was too great. And there was this feeling of imposter syndrome when things are going well and you have this secret or you haven't dealt with it. So you want to really be mindful and monitor yourself for any signs of relapse or deterioration. And finally, a really common and powerful intervention solution is advocacy and activism. And if you feel it's something you want to do, sharing your story or speaking out, or you don't have to share your story, you can advocate and get involved and help your community anonymously. But people feel really empowered. They feel like they're part of the solution, not the problem, when they get involved, when they advocate, when they blog, when they fundraise, when they organize walkathons, or even share social media posts about these messages, sharing this video. All of it is about spreading awareness, and now you feel like you are part of that solution, and it really helps survivors when they become advocates and activists. It's not for everyone. You have to really wait until you're ready. Lady Gaga certainly is at that stage now where she is sharing her story. She's becoming a leader in this area. She is advocating through her story. She is now helping others, and I think that's going to be very healing for her. There's good science behind that. When we take those steps, very courageous steps, it really helps us and it helps others. Thank you for watching this episode on my channel, Mental Wealth with Dr. Shimi Kang. I hope you have gained deeper awareness, deeper knowledge, more empathy, understanding, and most of all, empowerment around this really important topic of trauma in our human experience. And in this particular episode, we talked about sexual trauma, sexual assault. Thank you, Lady Gaga, for your leadership, for your courage and power in sharing your story. Stefani Germanata, we really appreciate, value, love you for your bravery. And you showed so many people. Remember that 1 in 3 girls and women, 1 in 6 boys and men, so many individuals who have experienced sexual assault, sexual trauma. You have shown them that you're not alone, and you are not alone. This is sadly common. You can recover, you can heal. The human being is resilient. We have power in us. The solutions are inside of us. Our science is incredible. We are hardwired for health, happiness, and success. So thank you so much for watching. Don't forget to leave your comments. Please subscribe, and I look forward to seeing you again on another episode here on Mental Wealth, where you can heal, protect, and optimize your most powerful asset, your mind.